I'm Dr. Ankit Madan, practicing as a hematologist-oncologist at MedStar Georgetown Cancer Institute at MedStar Southern Maryland Hospital Center. We see all benign hematology and cancer patients, which involves patients with solid tumors as well as malignant hematology. As an oncologist, I'm counting on every member of my team. That includes a radiation oncologist, surgical oncologist, nursing team, pathology and radiology. We all discuss our complicated cases in a tumor board, put all the minds to work. We devise a treatment plan that would be best tolerated by the patient and would achieve the most optimal outcomes. By being a part of MedStar Georgetown Cancer Institute, all of our patients have access to care that they would normally receive in Washington, D.C. Here in Southern Maryland, we have access to clinical trials and subspecialty oncology through access to tumor boards. I love my job. I love taking care of patients. I went into oncology because I wanted to have the long-term relationships with my patients. I'm a people's person, and I've always been wanting to be a part of their journey. I know cancer is a disease that not only affects the patient, but affects the whole family, and I want to be a source of treatment to them and to be able to allay their anxiety. And I love this part of my job when I can help patients go from the time of diagnosis to the time of their cure and see the happiness on their faces. A medical oncologist is trained in internal medicine and oncology. So being an internist helps me assess the general health and well-being of the patient, assess their ability, if they can tolerate and what kind of treatments they can tolerate. And then I integrate that with oncology training, which helps me devise a stage, a treatment plan for the patient. By combining the two, I can assess how much the patient can tolerate and what is the best treatment plan going forward with the most optimal outcomes. So there are certain common symptoms that one needs to be aware of. This includes unexplained weight loss, fatigue, any lumps on your body that were not there previously. So make note of those. There are certain symptoms that are specific to each cancer. Like somebody with lung cancer will have shortness of breath or chest pain, whereas somebody with colon cancer is going to present with blood in the stool and weight loss, as well as difficulty in passing bowel movements. Somebody with an ovarian cancer will have abdominal swelling. So each cancer will have its certain symptoms, but I want you to be on the lookout for weight loss and feeling tired and any lumps on the body that were not there before. Yes, early detection is very important. I always say an ounce of prevention is better than a pound of cure. There are few cancers that we can actually prevent before them happening, and that involves getting screening tests done. These include breast cancers, which can be screened through mammograms, colon cancer, so getting your colonoscopy at the age of 45 is pivotal, pap smears for cervical cancer screening, and then get a PSA check as well if you're an older male for prostate cancer screening. And always discuss with your primary care doctor about the screening test best for you. Now we have lung cancer screenings as well for patients who've smoked and are at increased risk of lung cancer. The latest advancements in cancer treatments include oral tyrosine kinase inhibitor medications, which target specific DNA mutations in the tumor and help to improve survival of the patients. The newer novel immunotherapy treatments such as CAR T-cell therapy has now come into existence, where we're using the immune T-cells of the patient's immune system, priming and engineering them to target the cancer cells to put cancers such as leukemia, lymphoma, and myeloma into remission. Immunotherapy is a form of treatment that uses your own immune system to fight the cancer. So our own immune system is able to target cancer cells, But what cancer does is that it puts the immune system to sleep by expressing certain proteins. Now, by giving immunotherapy, we block those proteins, activate your own immune system to fight the cancer. So this was actually deemed as breakthrough of the year in 2013, and now in the last decade has found its use in many cancers. It started with treating stage 4 cancer, and it's slowly moving its way into stage 3 for lung cancer, and has gotten approval for more solid tumors. Clinical trials are trials that lead to approval of new cancer treatments. Any new cancer treatment goes through a process of phase 1 and phase 2 trials, where we check what are the side effects of this treatment, and those that are tolerable then move into phase 3 trials, where we see if this new treatment actually is better than what we have at hand. So nowadays, clinical trials involve standard of care treatment and an investigational agent. What it's most important is that these clinical trials lead to FDA approvals for new medications that give us medical oncologists more options to treat patients. So MedStar Georgetown Cancer Institute affiliation gives us access to clinical trials in Washington, D.C., and now the same trials are coming to Southern Maryland. It also gives us access to opinions with disease-specific oncologists, so we can devise a treatment plan that you would get in a tertiary care facility at your own hospital nearby, and it really gives patients an advantage of getting a higher level of care than they would at any other community hospital.